Thank you for viewing this educational presentation. This module discusses pelvic floor muscle training for men. To begin our discussion, let us review some normal anatomy. This illustration shows the male anatomy of the pelvis from the side, revealing the bladder, which is a muscular pump, the urethra, which is the tube that urine flows through the penis, and the external urinary sphincter, or stop valve, that helps to keep you dry. As depicted here, the prostate surrounds the urine tube, and in a normal situation, therefore, urine will flow through the prostate. When the prostate is surgically removed, as shown here, a portion of the urethra is removed as well, and the remaining urethra is reattached to the bladder neck. The portion of the urethra that is removed contains the so-called internal urinary sphincter, or inner valve muscle. Following radical prostatectomy for prostate cancer, therefore, a patient becomes reliant on their external sphincter, or outer valve, to control their urine flow. This drawing shows the hammock-like layer of muscles called the pelvic floor. These muscles extend from the inner aspect of the pubic bones and attach to the sacrum or tailbone like a kite. Muscles also wrap around the urethra and rectum. Together, the pelvic floor supports the organs in the pelvis, namely the bladder, urethra, and the rectum. When these muscles and supporting tissues are weakened or damaged, such as following radiation therapy or surgery for prostate cancer, the result can be urinary incontinence, bowel incontinence, or sexual symptoms. Alternatively, when these muscles have too much tension, patients may complain of pelvic pain or difficulty initiating urination and bowel movements. The pelvic floor has three main functions. First, to provide support to the internal organs within the pelvis, as previously discussed. Second, to act as a sphincter or stop valve to prevent urine or fecal leakage. And third, to stabilize our back and pelvic girdle. Pelvic floor muscle training focuses on increasing awareness, strength, and endurance of the pelvic floor supports. Pelvic floor muscle training remains a first-line, non-surgical option for treating urinary incontinence or leakage following surgery. It has been shown to reduce the time to regain urinary control after prostate surgery. There are several reasons to do this training. One can better learn to contract the pelvic floor muscles, which can improve symptoms of incontinence in men following prostate surgery or radiation. In doing these exercises, a person can gain the ability to unconsciously contract these muscles. For example, when a sudden urge to urinate comes on, or prior to a sudden unexpected sneeze. This in turn can improve bladder control and prevent urine leakage. Pelvic floor muscle training can also improve sexual function and pleasure in some men, and it is used as part of a treatment program for fecal incontinence and certain pelvic pain disorders. It is difficult to truly know how effective pelvic floor muscle training is, but it is generally recognized that it may speed the recovery of urinary continence after prostatectomy. When used in other situations, such as after radiation or in men with pelvic pain disorders, they can also be very effective. Success with this type of therapy requires significant motivation and is a lifelong undertaking. Working with a dedicated nurse or therapist can optimize results. There are numerous techniques for improving pelvic floor tone and strength for men. The most commonly used methods include pelvic floor muscle exercises, biofeedback, and electrical stimulation. We will review these separately. Pelvic floor muscle exercises were originally labeled Kegel exercises after the physician who first published papers describing their success over 50 years ago. While originally developed to be done by women, they can be modified for use by men. These can be done alone, without assistance or aids, anytime, anywhere. In order to gain the maximum benefit from your efforts, it is important to learn to do these exercises correctly from the beginning. Performing incorrect pelvic floor contractions can actually worsen incontinence or other pelvic floor conditions. A dedicated doctor, nurse, or therapist can help you get started in the right direction. It is important to understand that in order to have a lasting benefit, these exercises must be done on a regular basis and lifelong. The keys to succeeding with pelvic floor muscle exercises are to learn to identify the muscles properly and to stay motivated and perform them regularly. To help identify these muscles, imagine contracting the muscles that would stop your urine flow. However, it is important not to perform the exercises during urination. This is just a method to help you visualize the muscles involved. Another way to identify the pelvic floor muscles is to imagine the muscles that you would need to fight off the urge to pass gas. If you have doubts about your ability to identify these muscles, it is best to consult your physician or another local expert. Without some assistance, some men simply cannot identify these muscles properly. To begin pelvic floor exercises, first empty your bladder. Next, you will focus on contracting and relaxing the muscles. It is important to understand that there are two types of contractions to practice. First, long or slow contractions to enhance the so-called slow twitch muscle fibers, which are fatigue resistant and provide sustained pelvic support. Secondly, short or quick contractions used to enhance fast twitch muscle fibers responsible for quick urethral compression during times of sudden increased pressure in the abdomen. Start with the long contractions. Contract first slowly for a count of 1, 2, 3, 4, 5. Then relax for a count to 10. Repeat this 5 times in a row to work the slow twitch fibers. Work to eventually hold your contraction for 10 seconds. Now try some quick contractions. Give a strong contraction that you hold for 2 seconds and then release quickly. Repeat this 5 times in a row to work these so-called fast twitch fibers. It is equally important to relax the muscle for twice as long as you held each contraction. In other words, if you contracted for 10 seconds, for example, relax for 20 seconds. The duration and number of contractions to be performed per day have not been standardized. However, many experts recommend that one set consists of 5 slow followed by 5 quick contractions. Start by doing 10 sets, 3 to 5 times per day. Then increase the number of sets every week until you can do 10 sets 10 times per day. At first, you may only be able to hold a squeeze for 3 or 4 seconds, but with practice, you should be able to squeeze and hold for about 10 seconds. Be sure to relax about 20 seconds between each squeeze to allow the muscle to relax. Then squeeze again as firmly as possible, but only using the pelvic floor muscles, not your muscles in the abdomen, inner thighs, or buttock. If you are doing the exercises correctly, you should feel this squeeze in the urethra and around the anus. Once you are underway, you should begin to notice improvements within a few weeks. Through long-term repetitive exercises, further improvements are achievable. Following surgery and once your catheter is removed, start doing pelvic floor exercises right away. Many men will actually start doing these exercises 4 to 6 weeks before surgery so they can learn which muscles to contract when they are pain-free and sensation is normal. Some studies also indicate that performing preoperative pelvic floor exercises can reduce the severity and duration of urinary incontinence following surgery. Once you become familiar with these exercises, you may wish to try them in different positions. Most people find it easier to start the exercises when lying down, then progress to sitting, and finally standing. When lying down, have your head comfortably resting on a pillow, with your knees bent and legs slightly parted. When sitting, ensure your back is secured by a straight-backed chair, feet planted on a flat floor, and knees slightly parted. And finally, when standing, lean on the back of a chair or counter, with your hips flexed, knees slightly bent, feet flat on the floor, with toes pointed outward. In normal situations, the knack is a subconscious reflex that occurs spontaneously without our knowledge. The knack refers to strong and well-timed pelvic floor contractions prior to and during events such as coughing, sneezing, or lifting that increase your abdominal pressure. This maneuver acts to help keep you dry. Following prostatectomy, you can strengthen your body's knack through performance of routine pelvic floor exercises prior to these events. Eventually, this pelvic floor reflex can be restored, providing automatic contraction of the urethra before such activities, which minimizes urine leakage. To test your knack, give a strong cough and see if you can feel your pelvic floor contract just before the cough. If not, you should practice this exercise. Remember, the key to maximizing results is practice, practice, and more practice. You will be given a program to work on independently at home, and you must practice daily. The exercises should become another part of your daily routine, such as brushing your teeth, talking on the phone, or sitting in the car at a red light. Many patients forget to do their exercises. If you watch TV in the evenings, performing exercises during commercial breaks, for example, may serve as both an appropriate time and reminder. You must continue to perform these exercises lifelong to maintain pelvic muscle strength and tone. A maintenance program of exercises 2 or 3 times a day will help keep you dry. If incontinence becomes problematic again, then restart the more intense exercises until you again reach continence. Gaining weight or a change in your health can affect your pelvic floor and bladder control. Along with regular exercises, contract your pelvic muscles to control symptoms, such as to suppress a sudden urge to urinate, to keep it suppressed while walking to the bathroom, or to prevent leakage prior to a cough, sneeze, a golf swing, etc. Biofeedback is a type of therapy usually performed by a dedicated pelvic physiotherapist or nurse. The goal of biofeedback is to enhance the effectiveness of pelvic floor muscle training. Biofeedback uses sensory signals to give feedback as to the effectiveness of an attempted contraction or relaxation of muscles. These signals may be auditory, visual, verbal, or tactile. There are several situations where biofeedback may be of great use, such as to enhance pelvic muscle training for overactive bladder and urinary incontinence, to improve pelvic floor relaxation during urination, and for the treatment of pelvic pain secondary to excess muscle tension. In the setting of post-prostatectomy incontinence, there have been mixed results with biofeedback therapy, some positive and some negative. Your healthcare provider can help guide you on this. Biofeedback allows one to quantify muscle strength. This gives you important information about your baseline muscle strength at the start of therapy, and serves as a marker to monitor your progression. Some methods of biofeedback include placing fingers in the rectum to gauge pressure, using a probe in the rectum which is connected to a meter or electrical signaling device called an EMG, or skin patches connected to a similar signaling device. Home devices, such as the one shown here, allow one to measure the strength of pelvic floor muscle contraction by squeezing the muscles around a probe which is connected to a gauge. This gives feedback on how well one is contracting the muscles. Pelvic floor electrical stimulation is available at some centers. It can be helpful to assist pelvic floor muscle exercises, but does not replace them. This treatment involves the application of a painless, low-grade electrical current to the pelvic muscles through surface electrodes on the skin or a probe placed in the anus. This serves to stimulate muscle activity and help you identify the muscles to squeeze, to lessen muscle contractions to inhibit the sense of urgency and thereby reduce symptoms of an overactive bladder, for example, and to improve pelvic floor muscle relaxation. PFES is usually taught by a dedicated clinician, such as a doctor, nurse practitioner, or physiotherapist, and is then continued at home. Studies indicate that electrical stimulation increases the effect of pelvic floor muscle training during the short term, but not after 6 months. Another important consideration is that patients may also experience more pain and discomfort with electrical stimulation versus pelvic muscle exercises alone. Again, your dedicated healthcare provider can guide you. The pelvic floor supports the pelvic organs, namely the bladder, urethra, and rectum. The pelvic floor muscles are closely integrated with the urinary valve or sphincter muscle. Weakness of these structures can cause leakage of urine called incontinence. Other dysfunction of the muscles can lead to pain, troubles urinating, or sexual dysfunction. Pelvic floor muscle training can prevent and/or improve these conditions. There are numerous methods of carrying out this training, and professional therapists and nurses can help you achieve the best results. Thank you again for viewing this educational program.